Welcome back to A Slice of Health, where health comes alive with bite-sized health education to keep you moving and become your own health champion, with stories that heal and knowledge that empowers. If you're listening to this on the day that we've recorded, then summer is over and autumn has just begun. So today, before I jump into it, I want to encourage you to take some time and think about the months that have gone by and make yourself one promise and stick to it. Just one promise and stick to it. Jordan Peterson normally says that you should treat yourself like somebody you are responsible for taking care of and watch how your life can change. But before we jump into our topic for today, I want to tell you a story. Becky, a 32-year-old woman, has been having headaches. She's had headaches for many years and has tried lots of different therapies, tablets, even herbs and drinks, and migraine teas to try to ease her headaches. She tried some acupuncture, which did seem to help, and she was told that if she managed her stress levels, her headaches would start to get better. Becky, however, has found that her debilitating headaches are increasingly causing her to miss out on important days at work, especially in the past year as she's been trying to get a promotion. Unfortunately, because she's been missing out at meetings, unable to make certain presentations, and just finding that she has to be in bed with the blinds drawn, the lights out, and no noise around, she's losing out on much more than she bargained for. Becky is now tired. The tablets have not worked. The teas have not worked. She wants to know, is there something else that she might need to try? At her last doctor's visit, her clinician recommended that she keep a diary observing what her migraines do when she's on her period. Becky has never thought about this before. She doesn't know if there is a pattern. She didn't know that there could be a pattern. And so Becky agrees and starts to monitor her periods alongside her migraines. And Becky finds that indeed there is a pattern to her migraines. There is a pattern that aligns with her periods. What does this mean for Becky? And what exactly are migraines? Migraines are a type of headache that can often affect millions of people around the world. They are much more than a bad headache. They're actually a condition that affects the brain and the nerves and also the quality of a person's life. Migraines usually are severe in nature. They feel like throbbing or pulsing headaches. They can affect one side of the head, but sometimes can affect both sides. And they can last up to 3 days if left untreated. Some people find that they have nausea or vomiting or an increased sensitivity to light and sound. And unfortunately, migraines can cause disability by virtue of preventing one from engaging in daily activities. There are different kinds of migraine. Some people have a warning sign, such as lights in their eyes, noises, changes in their fingertips or tingling or changes in speech. These are called auras. And some people don't have these auras, but it doesn't change the fact that their migraines can be just as debilitating. There are other kinds of migraines as well, such as chronic migraines or something called a hemiplegic migraine, where someone can develop a weakness in one side of the body that looks like someone that is having a stroke. This weakness often does resolve when the migraine has settled down. Now, migraines often have a pre-phase and also a post-phase. The acute phase can be as intense as the pre-phase in many people. Migraines, like many health conditions, can have triggers, things like stress, changes in sleep, changes in diet. Different factors in the environment can also contribute to triggers, things like bright lights, noises, changes in smell. Certain meals as well can cause people to have migraines or make them more predisposed to having a migraine. So certain people would find that if they eat certain kinds of cheeses, they're more likely to have a migraine. If they drink certain kinds of caffeine, they're more likely to have a migraine. But in Becky's case, she's noticing that there is a change in her migraine pattern each time she's having a period. Becky has something called a menstrual migraine. These are specific kinds of migraines that happen in women who are menstruating. Now, there are different kinds of menstrual migraines. A menstrual migraine can be a solely menstrual migraine where it happens only around the time of the bleeding. And for some women, they might have a menstrually related migraine, which can happen around the period of bleeding, but then also at other times of their cycle. And sometimes this might be around ovulation, pre-ovulation, post-ovulation, but they notice it at the same phase in their cycle. Now, it's important to ask, why does this happen? Estrogen specifically can be a factor in premenstrual migraine. This is because estrogen levels drop quite significantly, actually, just before menstruation. And this change can then trigger a migraine in women whose bodies are susceptible to having this. And so, because the brain then gets used to this fluctuation, it can also increase this incidence of migraine as well. So, what we know is that for women who have menstrual migraine, there might be a change in their ability to respond to the standard medications, as in Becky's case. And also, there might also be associated symptoms that come alongside the menstruation that might make their symptoms worse from the migraine, such as bloating, cramps, changes in mood, body sensitivity, and increasing fatigue that can come as a result of menstruation as well. So as you can imagine, migraines can cause disability, but having migraines associated with periods that then become debilitating can also cause disability, because a woman is then losing several days a month each time her period comes through. In Becky's case, we see that there's significant consequences for her in her profession, economically, and the professional impact as well as potential social isolation is actually quite high. What can Becky do? The first thing she's done that was recommended by her clinician is to track her cycle. But in addition to tracking her cycle and the migraine, it's also important to track associated symptoms as well as food triggers and environmental triggers. This way, she can minimize her exposure to certain triggers in hopes of minimizing the incidence and the frequency of migraines as well. Other things that she can do include using preventative medication specifically before the time of the expected migraine, and also potentially discussing using hormonal treatments that create a more level and consistent amount of estrogen exposure in her body that might then also help her stabilize the estrogen and reduce the incidence and intensity of menstrual migraine. As always, we would normally recommend lifestyle modifications, so trying to get into a good sleep routine, engaging in regular exercise, meditation, and relaxation to help stress, having a look at diet, avoiding triggers, staying well hydrated, and eating meals regularly. whole foods and nutritious foods as well. So there we have it. Becky is experiencing something called menstrual migraine. It's important for her and anyone that is experiencing these kind of symptoms to discuss with their doctor regularly and to discuss the other kinds of options that might be able to offer them help and relief, both in the short term when they have a migraine attack, but also in the long term. That's it from me from today. I hope you enjoyed today's episode. Until I'm back in your ear tomorrow with stories that heal and knowledge that empowers. Bye for now.